So tell me a little bit about your symptoms and how all of this started.
My headache symptoms began, maybe in the early to mid-70s, and they were infrequent and not too intense, so I just pursued over-the-counter type medicines. And after a few years, they began to arrive more frequently, so I finally sought help with my family doctor. And for years, we worked on these headaches, and after 3 or 4 years, they started to get more frequent and a little more intense. I asked him for directions on what we might try next, because this obviously wasn't working. So he guided me to a couple of different neurologists. I tried both, and pretty much with the same results. So now we're getting to the mid-80s, early 90s, and things are really beginning to pick up momentum. So at that stage, I went up to the Mayo Clinic, and again, they gave me certain meds to take on a daily basis, and there were quite a variety, and some more powerful not over-the-counter meds to get rid of the headache once I had the headache. And they seemed to work, but I was still getting the headaches frequently. But it only lasted for a short period of time, and then I cusped and went back up to my regular 12 to 14. And that's when they suggested Botox. Initially, I dropped back down to maybe 5 to 6 a month, but then after a year or so, I went back up to 15 to 16 headaches a month. So after 2 years of Botox, the doctor said, "Look, this isn't working. You're part of the 20% group that doesn't work well for." So they kind of lost interest in me. I'm back to square one. But in addition to all the headaches, I now have about 5 or 6 different meds I'm taking, and I can feel my mental acuity, deteriorating, and I was scared. I was frightened. So it took about a year, not quite a year, to get off of all those meds, and it was not a fun year. There was a lot of I won't say delirium tremor, but there certainly were a lot of withdrawal symptoms. And I started following the diet regimens that were suggested. And at first it seemed to work again, but here, the same sort of scenario occurred, and that was I started to deteriorate again.
How did you find the physicians at Dayton Interventional Radiology?
So I asked my family doctor, and he said, there are other methods, and we're certainly not at the end of the road. He says, but you might consider Dr. Syed at Dayton Interventional Radiology. And I said, listen, I'll follow your lead, because I'm out of ideas. So I came over to see Dr. Syed, and he suggested that he try a steroid injection into or somewhere around the occipital nerve in the back of my head. And I went 6 or 7 days without a headache. And I thought, gosh, this is terrific. And then it came back. I got 3 headaches in succession, 3 days in a row. And I thought, oh man, this is not going to work either. Well, then he told me that, he never expected that this would last more than a week. And that's when he suggested the neurostimulator. And I thought, boy, I'm ready to go. So he said, well, you're not quite ready to go. We need to put you through a test.
And so when you would have a headache and start to feel a headache coming on, you would turn on your stimulator, and then what would happen?
But it's really very difficult to describe. But there's certainly no pain involved in this, and you can increase or decrease the intensity. And there are a number of programs where they can change the lead that's most active, so they can move up or down the back of my head, or do it all at the same time, depending upon the intensity of the pain. It just feels, it feels comfortable. Yeah, but nothing uncomfortable whatsoever.
So if you'd say the pain from your headaches when they were at their worst. How would you compare that to now, generally?
So I still get, a lot of headaches, but they're just not as intense. The pain just isn't there, and during the period of time when I've got the stimulator on and I'm trying to get rid of the headache, why I just almost become unaware of the headache. So during the 6-week period, I took only one med, and that's by and large is the objective of this neurostimulator, is to reduce the headaches, reduce the intensity, and to significantly reduce the amount of meds. So it was a promise made and a promise kept. It did what it had to do, and after 40 years, I had my life back, really.